Hey guys, welcome back to my channel. I am Amara, and on my YouTube we talk everything medical related. Today we're going to talk about gastric tubing, what it is, how we do it, and what the dangers are. So if you like this video, please comment, like, and subscribe. Many reasons why we would place a gastric tube, and there are many gastric tubes, but today we're just going to focus on the most simple one. I will show you the placement, I will tell you about the risk, and I will tell you about the option. You may be thinking, what's a GI tube? Now, there are many GI tubes and many reasons why we use it. This tube we use to evacuate fluids of the stomach. Don't let yourself be fooled, because there are many dangers to using the gastric tubing. The tube, while inserting, can shift by movement or by coughing into the lungs. Wrong placement is also a very common one. When it's in the lungs, there's a chance of fluid from the stomach entering the lungs, what will cause an infection and a very, very nasty one. So you have to be very careful and very aware of what you are doing. Procedure, there are some bullet points we have to think about. We have to examine the nostril to see if it fits for insertion. We have to look what's the best position to insert the gastric tube. So, how do we know what length we should use on our patients? For this, we use the nose, earlobe, xiphoid methods. So we take our tube, we put it at the nose. I always go around the ear, that's just a preference. You can do also the earlobe, but it's just more easy to use the ear. And then I can see my fingers at my siphon bone. I get the perfect length that I need to insert into the stomach. I mark this one with a marker, so I know, or I just remember. It's time to insert the gastric tube. Before we do, we will ask the patient to blow his nose. Then I will ask the patient to breathe in and out while holding each nostril closed. So I know which nose he breathes better at. I can also use my pen light to see if there's no obstruction in it. So now I will put the gastric tube in some water, and I will ask the patient to bow his head a bit backwards, so I can perfectly place the gastric tube on the bottom of the nose. You can also place a hand. When the tubing reaches the throat, we will ask the patient to bend forwards. So we close the passage to the lung. While inserting the tube, the method is to ask the patient to swallow. When you say swallow, on the letter L. So it's swallow, low. And then you can also, I'm from Belgium, so it makes more sense. We call it slikken, And on the sound of the K, the patient has to slick or swallow. So in this case, I will use the letters L from swallow to indicate when the patient needs to swallow. When we're done, I will use my butterfly fixation to fixate it to the nose. So we have one free nostril and one with tubing in it. Then at the end, we will use a catheter stop or plug, so we don't have to worry about stomach fluids going out. But now we're in, but we're not sure yet if it's done correct pH test. So then I'm fully sure the catheter is on its place. A couple of methods we can use. The old school method is using a glass of water. We did everything in our time, from inserting the end of the tubing to see if there was bubbles, because in the stomach there would never be bubbles. In our lungs, of course, it would. We would also take a tube and a syringe, take some air, take our stethoscope, and then listen at the area, the stomach area, and if it would be correct, you would feel like a blob. But it isn't a good method because our catheter can also be too deep. The best method is RX, has not always an RX by the hand. So we're going to do my favorite method, and that's retracting the stomach fluids. So I know we're in the stomach because we're retracting the fluids. Then I will use my container. I can put a bag on it or whatever is needed for the patient. I hope you enjoyed this video and I hope to see you soon.